Welcome to the PharmaVOICE Editor's Take video series, filmed live at the 2011 DIA Annual Meeting in Chicago. Hosted by Taryn Grome, editor of PharmaVOICE. In this session, Taryn meets with Jennifer Goldsmith, Vice President, Veeva Vault.
Jennifer, it's great to meet you. Can you please discuss the benefits that R&D can derive from moving its processes to the cloud?
It's interesting. Cloud technologies in general present a very strong opportunity for R&D. Some of the benefits that you can achieve through the R&D process are common benefits, things like cost effectiveness, the ability to manage processes on a more global basis, the ability to better manage compliance by having better visibility into that overall process. Perhaps the most overlooked benefit, however, is the benefit of collaboration. If you think about cloud is collaborative in its very nature. And so processes today, we think about R&D processes. Let's take an example. I'm working with a vendor who helps to produce my submissions around the world. Today, that process of bringing that vendor on board is very difficult. I need to give them VPN access. Perhaps I need to give them a laptop. Perhaps I need to give them an ID to my network. Perhaps I even need to give them a dedicated VPN line. And that process can take anywhere from hours to days to even months. The cloud, on the other hand, presents the opportunity to share information readily, to share it quickly and in an effective format. So that same process that we just walked through to give access to that vendor is a process that actually takes minutes inside of a cloud-based system. I very simply give that vendor a user ID, I assign them a security profile, and they're able to initiate their ID and start working in a matter of minutes.
To follow up, what are the benefits of enterprise content management for clinical trial sponsors?
Enterprise content management is actually critical when we think about clinical studies and we think especially about the clinical trial sponsor. When we look at the amount of information that's produced for a clinical trial, it's not just the data that's critical, it's the documents that's produced around those data points, it's the documents that are produced to express that data in a format that is then submissible to the health authority globally. When we look at enterprise content management, there are a few key areas that are critical. One is very simply the quality and compliance factor. Today, there are many different copies of the information that may be floating throughout an organization. There's a risk associated with version mismanagement, with having the wrong information surface to people at the wrong points in time. The benefits, however, are also critical. When we look at enterprise content management, one of the biggest benefits for the clinical trials process is very simply the visibility into that process. We think about the process today. In many cases, we're mailing that information into the sponsoring organization. We're actually moving that information to the organization in ways that are inefficient. It may be an FTP process. It may be an email process. When we think about enterprise content management, though, it provides visibility end-to-end into the information that's being produced. So it allows me overall to make better decisions about my clinical trials process much more quickly because I can see the results of that process as they're emerging as opposed to the tail end of that process overall.
Additional Editors Take videos, as well as podcasts, white papers, webinars, and more, are available in the resources area at www.pharmavoice.com.